Today's my video topic is ultrasound technology in hospital. Ultrasound technology in hospital utilize sound wave to create image of internal organs and tissue. Here is the breakdown of how ultrasound works and its significance in healthcare. 1. Principal ultrasound technology works by emitting high frequency sound waves into the body and detecting the echoes that bounce back from the internal structure. These echoes are then converted into real-time image, allowing the healthcare provider to visualize the anatomy and function of the organs, tissues, and blood flow without the need for ionizing radiation. 2. Diagnostic imaging. Ultrasound imaging, also known as sonography, is widely used for diagnostic purpose in hospital. It can assess various body systems including the abdomen, pelvis, heart, blood vessels, musculoskeletal system, and reproductive organs. Ultrasound is particularly valuable for evaluating fetal development during the pregnancy, detecting and abnormality in organs, diagnosing conditions such as gallstones or kidney stones, and guiding interventional procedures such as biopsies or injections. 3. Non-invasive and painless. Ultrasound imaging is non-invasive, painless, and does not involve exposure to ionizing radiation, making it safe for patients of all ages, including pregnant women and infants. It is often used as a first-line imaging modality due to its safety profiles and ability to provide real-time image during procedure. 4. Dynamic imaging. One of the key advantages of ultrasound technology is its ability to provide dynamic real-time imaging of moving structure such as the beating heart or flowing blood. This enables healthcare providers to assess organs functions, blood flow pattern, and the effectiveness of the intervention in the real time. Portable and versatile. Ultrasound machines come in various sizes and configurations, including portable and handheld health device, making them suitable for use in different clinical settings, including emergency rooms, operating rooms, intensive care units, and outpatients clinical. Their portability allows for bedside imaging and rapid assessment of patients without the need for transport to dedicate imaging facility. 6. Guidance for procedure. Ultrasound imaging is often used to guide minimally invasive ultrasound visualizations. Helps healthcare provider accurately target specific anatomical structure and avoid surrounding tissue, reducing the risk of complications and improving procedural outcomes. 7. Safe for monitoring. Ultrasound technology is safe for repeated use and can be used for longitudinal monitoring for potential with chronic condition or during pregnancy to track fetal growth and development. It allows for non-invasive assessment of disease progression, response to treatment, post-operative recovery. In summary, ultrasound technology is valuable diagnostic tool in hospital, offering non-invasive imaging, real-time visualization, and versatility for a wide range of clinical application. Its safety portability and dynamic imaging capability and make it an essential component of modern healthcare. I hope this is enough today. Thank you for watching this video. Thank you.